I'm Dr. Eddy and I'm an associate specialist in reproductive medicine and I'm the clinical lead for the fertility preservation service that we have in the unit here. Essentially it's a rapid access service with dedicated pathways for these patients. So it has actually built up over the years and at the present time we see anywhere between 120 to about 130 patients on an annual basis. What we are actually doing is also trying to improve pathways so that a lot of local cancer centres have a directed pathway so that as soon as they make the diagnosis, then they can directly access our unit so they can have a very rapid referral for the patients. And most important is an early referral in order to give that person a chance for us to offer them fertility preservation and to complete the process of fertility preservation without any delay in the start of their cancer therapy. Though cancer therapy will probably help to treat many of the cancer patients successfully, unfortunately one of the side effects of either chemotherapy or radiotherapy is a risk of gonadal failure. So a young woman has a risk of developing ovarian failure, which means she may become infertile when she's completed her cancer therapy, and so also in the young male. We offer options of fertility preservation either by freezing their sperm or freezing their eggs or embryos in order to give that young person the option of having a family in the future. We have had some of our patients come back. Obviously, the treatment of cancer lasts a long time, so patients don't return for several years, but those that have come back, we're really glad to say that we have had many successful results with these patients, which means that they can go on to have a normal life with all the expectations that one would hope to have in a young person. We've got a lot of backup over here because we have a very large lab. We also have the PGD, which is the pre-implantation genetic diagnosis, attached. And because we have a dedicated fertility preservation service over here, it just means that the patients can come. There are some who may need a PGD input as well. It's all on one site, and that is something that we can address as well. And also the fact that we provide long-term follow-up for these patients. We not only run fertility preservation, but we also offer long-term follow-up for these cancer patients, which is really important and is not provided with the average fertility unit because we have a dedicated service for these patients. So it's long-term care that we provide for them in coordination with their cancer teams.